Tea's up. Everything all right?
Fine, yeah.
You sure?
Yes.
I've made you an appointment anyway.
There was no need.
Better safe than sorry, darling, right? It's just a checkup. No hurry. I'll take you in.
Bad hair day? Well, I mean, not literally.
No, it's fine. I'm expecting my exam results today.
Ah, think positive. Besides, you've got too much on your plate today for worrying.
Huh?
Night shift. Doctor's co-op?
Oh, I've completely forgotten.
You can't duck out this time. Besides, it's a piece of cake.
Yeah, I know. It's just I haven't done it for ages.
All right, well, I'll arrange cover this afternoon. You can knock off early, get down there, refamiliarise yourself.
Oh, thanks, Heston. You're an angel.
And you get a lie-in tomorrow.
Woo!
She said she didn't feel the baby move overnight. Yeah, she did a urine test, nothing. Yeah, we're on our way in now. Well, she's not due for another 10 days. Yeah, we're on it. Okay.
Hello, can I help?
I hope so, darling. We're not registered here, but my partner's a bit concerned about a baby. It hasn't been moving overnight. We're only in Leatherbridge temporarily, but we thought it seemed sensible to get it checked out, you know.
No, that's all right. We can treat you as an emergency patient if you'd just like to fill that in.
It's just to put our mind at rest, really, you know.
Well, it's a bit of a worrying time. How long have you got to go?
About 2 weeks.
Would you like to see a female doctor? Dr. Bell's got a cancellation.
That's perfect.
Right. Well, if you just take a seat, complete the form, bear with us, because she's very busy this morning.
You're an angel. Cheers.
Julia Parsons. Oh, hello, Miss Parsons. This is Sybil Lambert speaking.
Oh, hello, Mrs. Lambert. How are you?
Oh, not so good, I'm afraid.
Oh, I'm sorry to hear that.
That comes to us all.
Don't grow old, dear. That's my advice.
So how can I help you?
Well, you already have, by sending me my ministering angel.
I mean, Daniel, Dr. Granger. I'm really just ringing to say I'm so impressed with his professional manner.
And his dedication to my care. He's like a breath of fresh air to me, a real tonic.
Well, I'll make sure that I pass that on. I'm sure I'll be very flattered.
Quite right, too. I'm not easily pleased.
Well, Dr. Granger is a very valuable member of our team. And thank you very much.
Thank you. Bye-bye now.
Well, you're very brave, travelling around the country at this late stage.
Had to mark our hospitals on a map. It's a business trip. You see, I work for a salvage firm up in Glasgow, but they're thinking of buying a local scrapyard, so they've sent me down for a couple of days to check it out, you know.
And you didn't want to be stuck at home alone expecting a baby? OK, well, if I can just give you a quick examination, check everything's all right, if that's OK?
Whatever. You can wait outside.
Oh, that's all right. I'm happy.
I don't want him here.
Sorry. Didn't mean to.
No, it's no problem. She's just a bit tense right now. Aren't you, darling?
Well, that's understandable. I'm sure there's nothing to worry about, Kim.
See? There you go. Right. I'll be right outside, OK?
Is everything all right?
Can you just get on and do what you've got to do?
Simon.
Oh, yeah, thank you.
Well, your ears burning earlier on. I was talking to Sybil Lambert.
Oh, she all right?
Yeah, she's ecstatic. Apparently having a massive crush on a suave, handsome doctor 50 years her junior has done her the world of good.
We just hit it off.
Oh, you kept that one quiet, Daniel. Seriously, though, she couldn't stop singing your praises. Called you a treasure.
Oh.
Well done, anyway. Obviously setting a new gold standard. Let's hope others take note.
baby's heart rate seems fine, but I can understand why you're concerned about the lack of movement, Kim. All right, I don't mean to pry, but are you using drugs?
I had a habit a while back.
But you're not anymore?
Of course not.
Sorry, but I had to ask. Look, I know I'm not your regular doctor, but you can talk to me. If there's something wrong, if there's a problem or you're worried about anything.
I just want this baby out. I want the whole thing to be over.
Well, look, if it's any consolation, I'd be frightened too.
You got kids?
No, but hopefully one day.
Yeah, well, I don't want them. It's too much hassle.
Isn't it a little bit late?
Are we done?
Yeah, of course. I'd actually like to refer you to St Phil's for an ultrasound. It's just a precaution, really. Is this your Leatherbridge address?
Yeah.
Okay. Well, I can call ahead and let maternity services know that you're on your way.
You're all right, I'll make my own way.
I'll see you out.
Look what's here.
Ah, the eagle has landed.
Shall I give it to her straight away?
Definitely, don't prolong the agony.
If you need me later, I'm actually going to be on call, so thanks. Good luck.
The course of true love never did run smooth.
Well, you can say that again. She doesn't want him near her. I don't even think she wants the baby near her.
First time, Mum?
Yeah, but there's a difference between feeling nervous and feeling like you have made a huge mistake.
Physician, know their limits. Now, on to more pressing matters.
I feel like we need a drum roll, really. Ta-da!
The moment of truth.
I feel tingly.
Sorry, can you just hold on to that for now?
But...
No, I'm not sure if I can, just...
Do me a favour. Keep her out of the staff room at lunchtime. We're discussing party arrangements.
Yeah, but what if she's...
Either way, we'll all need a drink.
We'll just get inside. Sit down, relax. Right?
Where are you going?
It's business.
Where you belong?
Why, what's the problem?
Nothing, it just feels like it might be coming.
Well, it's not going to come in the next 5 minutes, is it?
Maybe you should call the midwife anyway.
Go on, lie down or something. Right?
How did it go? Did you see the doctor? Is the baby okay? Where's Terry gone?
I'm not leaving here until I see my own doctor.
No, Mrs. Snelling, you see, this is what I'm trying to tell you. Dr. Kwame doesn't work here anymore. He hasn't worked here for years, do you remember?
Nonsense. He gave me a blood transfusion last week.
I think you're getting a bit confused.
He saved my life. He has magic fingers.
Karen, do you know a Treforest Road in Leatherbridge?
I used to be chair of the Community Health Council.
I've never heard of it.
Well, you will, young lady, let me tell you.
Look, I've checked the A to Z. I mean, why would you give a false address? Oh, I need Heston.
Hang on.
I know my rights. I shall not be moved.
Mrs. Snelling.
I'm going to go and spend a penny. And you tell Dr. Kwame that I shall be back in a tick.
Melody.
Are you getting contractions? Maybe you're going to be early. First time for everything. Can I ask you something? Are you having any second thoughts now that it's really near? I don't want it. Some other mum really does. I suppose so. It's better this way. I can't look after a kid. I've been thinking about her. What my baby's mum and dad will be like, what sort of a life she'll have. Take the money, forget it. Do you think it's that easy? What? You gonna tell Terry you've changed your mind? Thought not. I didn't know it would be like this. I need a bath. No, what I'm saying, Dr. Bell, is that it isn't a crime to register at a surgery under a false address. I appreciate that. Okay. 10 Treforest Road. You're sure that's the address he used? Could you describe him for me?
Mrs. Snelling, is that you in there?
Is he here yet?
Who?
Dr. Kwame.
Come on, Mrs. Snelling, you can't stay in there. Come on, open up, please. If you're not doing any business. I need you to come out now.
No.
I'm going to have to fetch the practice manager.
Good. I want to make a formal complaint.
Cover sorted, you can head off when you like.
Thanks, Heston.
Thought this would tide you over. Cockaliki soup is very nourishing in the wee small hours.
That's really kind. Thank you. Oh, I phoned the police about that false name and address.
Oh, you did?
Yeah, they said they'd be in touch, so...
What a fine and upstanding citizen you are. Which reminds me, I wrote a spankingly good reference for you for the Cheney Polyclinic. So, don't waste my efforts by turning it down.
I didn't realise Jim had said anything.
Oh, he didn't. I know Diana Wakeling, one of the partners, and she rang me up to run the rule over you before making an offer.
Oh. I don't know what to say. I mean, we haven't exactly seen eye to eye recently.
Oh, my dear Melody, at the risk of savaging the great Voltaire, I may not always agree with your diagnoses, but I will defend to the death your right to make them. We've had our differences vis-à-vis certain mental health issues, but that aside, I think you have the makings of a jolly fine doctor.
Thank you.
So don't squander the opportunity. Carpe diem, Melody.
Well, I can't seize anything if I've not passed my AKT, so I'm sorry if I've wasted your time.
Well, I don't think you have. There's one way to find out. Shall we open the...
No, I can't, Heston. Not today. Tomorrow, though, I promise.
Used to be one of our regulars.
She's so stubborn.
Yeah, she got worse since the Alzheimer's. Her daughter doesn't usually let her out of her sight, though.
Mill Health Centre. Sybil, it's Dr. Granger here. You don't sound too good. What's happened?
Mr. Snelling! Mr. Snelling, are you all right?
Do you think she's,
Mr. Snelling? Hello?
Well, she's sort of slumped. I can't see if she's breathing.
Right, OK, we've got to get this door open straight away. I've got a release key in the office.
She...
Fast asleep. Yep, I think so.
They've gone! They've all gone!
Okay, look, you stay put. I'll be over as soon as I can. Okay, won't be long. Just one moment.
Etienne Ovide. You must be Melody?
Belle, yeah.
That's a beautiful name. It's very musical.
Thank you. Is yours,
French, yeah. My father is a surgeon in Marseille, but my mother is very English.
Oh. Where's your practice?
Birmingham. Yeah, it's big, busy. You?
Oh, the mill, Leatherbridge.
You work there long?
Not really, no. I'm just waiting on my AKT results.
Okay, so you might be moving on soon. That's a shame.
Well, I don't know yet. I mean, I haven't opened the envelope. I'm too scared. Sorry, that sounds pathetic, doesn't it?
I left mine in a drawer for 3 days. I had to be so drunk before I could open it.
Really?
Well, it's just an envelope, but what's inside changes your life.
Yeah. Oh! Ow!
Are you okay?
This is my cockleaky.
Well, my grandma used to make that. I hated it.
Yeah, me too. Sorry, I'm a bit nervous because I haven't been on call for ages.
Well, you'll be fine. Just make sure you keep your mobile on you, switched on.
Yeah.
Any problems, just give me a call. You got your own excellent, dedicated doctor ready and waiting.
That sounds very nice, thank you.
Any luck?
Actually, one of the neighbours answered the phone. He popped in to see how she was doing. He was a bit worried that the house was empty and unlocked.
Well, the daughter lived with her.
Yeah, so did I, but apparently she had a job offer and up to move to London.
Left her cope on her own.
Apparently. Apart from home help twice a week.
Oh, there's no way to end up, is it?
No, it's not.
I plan to grow old with my family around me. Done my fair share of looking after it with their turn.
Anyway, I'm going to take her home. Social worker promised to pop in later. Right then, Mrs. Snelling, are you ready to go?
Yes, thank you. That Dr. Kwame works miracles.
Hello? Hello, sir.
Hello. Cream tea? Oh, I know, don't look at me like that. So I exaggerated a bit.
You made me believe that you were at death's door, really suffering.
I was. From loneliness.
I can't just drop everything, Sybil, and come for tea.
No, Daniel, I never expected you to drop everything. But now you're here.
Well, I suppose I've finished work for the day. You know, you are incorrigible.
Oh, thank you, darling. I know that was a compliment. Now look at you, you're wasting away. You must have an eclair. That's better. I do find your presence very comforting. A little bit of what you fancy never harmed anyone.
French women are so glamorous. I'd stick out like a sore thumb.
I disagree. Anyway, real beauty is not about the labels you're wearing.
Exactly.
I like to look at who somebody is, not their clothes.
Right, so when you're doing this looking, what are you hoping to find?
Honesty. Sense of humor.
Yeah.
Of course. And a kind of gracefulness.
Oh, I'm sorry.
No, it's fine.
Sorry. Just really clumsy.
Oh, I better get that.
Is that the
Yep, first call of the night. I don't know if I can.
No, honestly, it's the least I can
The
do.
driver has sat nav. He'll get you there safe and sound.
Okay.
Dr. Levine speaking.
I don't care, just give me the phone! Terry's got someone sorted. He said we weren't to ring anyone else, remember? Yeah, well, maybe I've changed my mind, okay? What's someone qualified doing? It's not some dodgy rent a midwife. Terry's not the one having a baby, so just give it to me!
Have another bite. Build up your stamina.
You're a wicked temptress, you are.
Ah, you know you love it.
Honestly, I can already pinch an inch.
Really? You look all skin and bone. I like a man with something you could get hold of.
Like a big fat wallet.
No, that's always a bonus. You be mum, will you?
You all right?
I'm fine.
You're in pain.
As I was saying to your charming Miss Parsons, I couldn't have wished for a more attentive doctor. Daniel, you've been so kind and thoughtful. Such a gentleman. I really don't know how to thank you.
You already have. It's a pleasure being with you.
Oh, you little charmer. I'd like you to have these. They were my husband's. Like most men now, Malcolm doesn't wear cufflinks, and I notice that you do. Indulge me then. Let me see them on you.
They're perfect, Sybil, but I really shouldn't accept them.
Oh, shouldn't, couldn't, wouldn't. Don't hurt my feelings.
Well, if you're sure, then thank you.
My husband used to call them his lucky cufflinks.
Why?
Because he was wearing them when he met me. I think they might just work for you, too.
Thank you, Sybil.
I think they'll suit you very well.
Terry, I think you better get back here.
Thanks, Mr. Carson, and remember to keep up those fluids, okay? Hello? Oh, Etienne, bonjour, ça va? Yeah, it's going fine, thank you. Actually, I'm really glad you called because I wanted to apologise again for spilling tea all over you and just to say how nice it was to... Oh, sorry. Yeah, of course I realised you wanted to talk to me about my next patient. Well, she's already having contractions.
I'll pop in again soon, Sybil, promise.
I thought doctors' home visits were a rarity these days.
Not for the truly dedicated. Is there a problem?
Why are you lavishing so much time on it?
Lavishing?
You must think I'm blind. It's obvious what you're after.
I'm sorry, I'm confused.
I heard you. Flirting. Buttering her up. It's sickening. Just stay away or I'll ring the surgery and explain exactly why I want them to send someone else.
Goodbye, Mr. Lambert.
Thanks, Frank. If the community midwife is busy, I'll maybe gone a while. See ya.
What should I do? Get that quick!
Oh, hello. I'm Dr. Bell.
I'm here!
Kim.
Get me out of here!
Yeah, I just need to check...
I want to go now!
Okay, how close together are your contractions?
I want drugs, pain relief, epidural, cesarean, please!
Okay, I'll call an ambulance.
Kim, you can't! Just shut it, Alicia! You go and they won't pay you.
Pay you? Pay you for what? Will someone tell me what's going on here?
Yeah. She's having a baby. And you're going to deliver it.
No, I'm calling an ambulance and then I'm calling the police.
You do your job. You won't get hurt. Now you get upstairs. You go with her. Come on. Come on, hurry up!
I'm sorry, but the person you called is not available.
Excuse me, mate. Sorry to bother you. I've got a flat tyre here and I'm going to be late for my work, so you wouldn't mind giving me a hand, would you? Sure. Cheers, mate. I appreciate it.
You're doing so well, Kim. Just resist the urge to push, okay?
How much longer?
Thanks. Just concentrate on the breathing, okay? Big, long, deep breaths. Come on. Good. Look, I need to get out of here and get some help. Can you distract her?
The windows are all locked. He double locks the doors too.
Are you okay? You're not...
Contractions. They're not that bad yet, though.
Oh, great. Hey, tell me now.
Right here, darling. What's going on?
Kim needs to be in a hospital. Okay, this is her first baby. I have no equipment, and if there are any complications...
Well, what should there be? It's a natural process, isn't it?
You must realise my driver will have called the police by now. Just let us go.
Get out. Just give me a wee knock when you're done. Right.
Wait! It's okay. It's okay. When he comes back, I'm going to keep him talking, and you just get out of here and go. Okay? Call the police. Just do it and get yourself to a hospital. Terry, come back! You can't leave us here!
Dr. Carter, I'm shocked. But Melody trusted me with that. I would never for 1 minute allow such a blatant invasion of her privacy.
Terry, come back!
A migraine can prove deadly as Dr. Sloan discovers and diagnoses murder next this afternoon here on BBC1 Scotland.